Welcome. This is Doug Shadell, State Director for AARP Washington. Thank you for joining us today. I want to welcome you to this important discussion about the coronavirus. AARP Washington is a nonprofit, nonpartisan member organization that's been working to promote the health and well-being of older Americans for more than 60 years. And in the face of the global corona pandemic, AARP is providing information and resources to help older adults and those caring for them. I think we're all grateful that 2020 is in the rearview mirror. COVID, of course, is still with us and will be for some time, but 2021 holds great promise of broad vaccine distribution across the country. Yet as we move through the second month of the year, major challenges remain. The virus has mutated, and continued outbreaks nationwide show just how difficult prevention efforts can be. And while vaccines are on the way, supply is limited, distribution has been slow, and many Americans continue to feel the emotional and financial hardship from the pandemic and fears about what is to come. We're very fortunate today to hear from two experts in this area, Dr. Scott Barnhard, physician and professor of medicine and global health at the University of Washington, and Patty Hayes, director of public health for the Seattle-King County area. And they're going to be talking about how we can combat COVID in the present situation. We'll also hear the latest about vaccine distribution in King County. If you participated in one of our Tele-Town Halls before, you know this is similar to a radio talk show, and you have the opportunity to ask questions live. For those of you joining on the phone, if you'd like to ask a question about the corona pandemic or the vaccine of our guests, press *3 on your telephone keypad now to be connected with an AARP staff member who will note your name and question and place you in the queue to ask that question live. Again, if you want to ask a question, press *3 on your telephone keypad. If you're listening through our Facebook audio stream, please leave your question in the comments section. We have quite a few folks, almost 2,000 folks already on the line, and we want to get started. I want to extend a welcome to all of you who have joined this Tele-Town Hall Live. My name is Doug Shadell, State Director for AARP Washington. I want to thank you for joining this important discussion on the global corona pandemic. We're talking with leading experts and taking your questions live. Without further ado, I'd like to introduce the first of our two guests. First, Patty Hayes, Director of Public Health for the Seattle-King County area. Seattle-King County Public Health serves the 2 million residents of King County, Washington, and it's the 9th largest local health department by population in the country. Prior to her role as director, Patty led the department's largest division, Community Health Services, which delivers personal health services at locations across the county. She also worked for the Washington State Department of Health in various positions, including Assistant Secretary of Health for Community and Family Health. Patty, welcome to the Tele-Town Hall.
Thank you, Doug. I'm so happy to be here, and hello to everyone on the line. This morning, I'd like to cover 3 things with my time. First, I want to give you a snapshot of where we are right now with the pandemic. Then to go over who is eligible for vaccine right now and where you can get information about appointments. And finally, to provide some information about what King County is doing to improve vaccine access. So I'll start off by sharing a brief update on the status of our COVID-19 pandemic in the community. And let me start by acknowledging that a pandemic, which this country has not seen in over 100 years, is extremely traumatic to everyone. A pandemic is something where we have a novel virus and we're learning lifetime through the science on what this virus is like, how it affects us, and what we need to do to get through it. So I want to thank all the listeners for all the work, the patience, and just the stick-to-itiveness that we all need right now during this traumatic time. The good news right now is that we are seeing fewer cases of COVID-19 than we were 2 months ago. In early December, we hit a high of 700 cases per day in King County, whereas now we're averaging a little over 160 cases per day. We are still averaging 2 deaths per day from COVID, and the average age of the people who are dying from COVID is 81 years old. As you all know, older adults are at much greater risk of severe illness and death from this disease. And we continue to see disproportionate impacts of COVID-19 in South King County, where those communities have been particularly hard hit by the virus, which is why it continues to be critically important to focus our efforts on where we see these disparities. The new variants of the virus that you may have heard about from the United Kingdom, from South Africa, and now we have variants popping up from the United States. Some of these we're discovering are more contagious, and they also present a serious risk to our progress, so we're watching them very closely. So while it's a positive sign that we're seeing a decrease in the number of cases, we're still at a high of COVID-19 in our community overall, and this means we need to continue the practices we put in place over this past year to keep everyone safe and to slow the spread of the virus. That's wearing a mask, social distancing, washing your hands frequently, and getting a COVID-19 test if you're experiencing symptoms, for example. These are the strategies that help keep us safe. And now we can also add vaccine to our strategy. So I'll pivot now to provide you some information about who is eligible and where you can find out about appointments. Let me start by saying that because of the limited number of vaccines that are available right now, the supply is just very limited. The State Department of Health, following the federal guidelines, has put in process a criteria for who would be eligible based upon who is most at risk and also our frontline workers, and that's where we're starting. So right now, the following people are eligible to receive the COVID-19 vaccine: healthcare workers, staff and residents of long-term care facilities, paid or unpaid caregivers, people who are 65 and older, people who are 50 and older who live in a multi-generational house, meaning there are 2 or more generations living in a home and they have to meet one of these criteria. Either they cannot live independently, in other words, they receive support from a relative or caregiver, or they live with and care for a child, like a grandchild. So now I'll move on to where you can find out more about vaccines. If you want to find out if you're eligible or you want to look for an appointment, here's what you need to do. The first option is to call your provider's office, your doctor or your nurse practitioner, to see if they have available vaccination appointments. Some of the systems, like those who are members of Kaiser Permanente, may have actually been called by their provider about this. Another option is to go to the State Department of Health's website at www.findyourphasewa.org. This is what you probably heard about, called the Phase Finder app. And it will take you through a series of questions and let you know if you're eligible for the vaccine, and then it will provide you a list of possible vaccination locations you can contact if you're qualified. And we know not everyone has access to a computer. So if you can't use the online Phase Finder, or if you need language interpretation, or you just need assistance, you can also call the state's COVID-19 Assistant Hotline. And that number is 1-800-856-5816. And I'll be repeating all these numbers and sites for you in a little while. But this phone number can help you register for an appointment if there are any. We know it's been really challenging right now. The call volumes and the wait times are high. The State Department of Health is adding more people onto this statewide hotline. It's because there's not enough vaccines for everyone who is eligible, which means there are not enough appointments for everyone who wants one. I know how frustrating it is for those of you that have been trying to find a vaccine locally, and it's taking longer than any of us anticipated. But eventually, the vaccine supply chain will improve, and there will be enough vaccines for everyone who wants it. But in the meantime, you may not get through the population who is currently eligible until later this spring. In my last couple of minutes, I want to talk specifically about a few of the things that King County is doing to try and improve vaccine access. Let me start by giving our local vaccine website for the Public Health Seattle-King County. That website is www.kingcounty.gov/COVID/vaccine. We have a lot of information about the vaccine online, including links to the state phase finder and the COVID-19 assistance hotline. You will also find information about our 2 high-volume vaccination sites in South King County that opened on February 1st, one in Auburn and one in Kent. Because vaccine supply is so limited, these sites are for people who live in South King County right now and meet the age criteria that put them at higher risk. But as the vaccine supply improves, we plan to open these sites to additional people, and there will also be sites in other areas of the county. Finally, we know high-volume sites won't work for everyone, so we're also working with our EMS partners, and you may have seen this on the news, to send out mobile vaccination teams, and we're starting with adult family homes and low-income senior housing. We are also beginning to plan for community-based pop-up vaccination clinics that might be held at meal sites, senior centers, and faith-based organizations. And we have been working through our network of community organizations to be intentional about reaching communities of color. It's the work of our community partners that's helping those most in need get registered for appointments, build the trust, and bridge language gaps. In sum, safe and effective vaccines against COVID-19 are a major breakthrough in preventing and dealing with this pandemic. But right now, we don't have enough doses to vaccinate everybody who's eligible and who wants one, which means it's hard to find appointments. For the doses that King County itself is getting, we're prioritizing distribution based upon individuals who are most vulnerable. And right now, we've been starting with those people who are 75 or older, and we know that some of the health systems and pharmacies are also serving 65 and older. We're also prioritizing those who live in long-term care and congregate settings and our Black, Indigenous, people of color communities. We're particularly focused in South King County, which has been hit twice as hard as the rest of the county by this pandemic. So we are really trying to target our resources so we help save lives and then expand throughout the county to get this under control. Thank you so much, and I'll turn it back over to you, Doug.
Okay, thank you. If you're just joining us, you've been listening to Patty Hayes, who's the Director of Public Health, the Seattle-King County area. And this is a live Tele-Town Hall on the coronavirus. My name is Doug Shadell, AARP State Director. We'll be taking your calls live. And if you'd like to ask a question of one of our guests, please press *3 on your telephone keypad now to be connected with a staff person who will note your name and question. We have a lot of questions in the queue, but before we start taking questions, I'd like to introduce our second guest, Dr. Scott Barnhard, a physician and professor of medicine and global health at the University of Washington. Dr. Barnhard is a board-certified physician at the Chest Clinic at Harborview and a UW professor of general internal medicine and global health, and he served as chief of the University of Washington Medical Center's Occupational Medicine Clinic and was medical director of Harborview from 1999 to 2008. Thank you, Dr. Barnhard, for taking time out of your schedule today. Would you like to make a couple opening remarks?
Sure. Thanks, Doug, and thank you, Patty, and good morning, everybody. It's a real pleasure to be here and to join you. I guess I would just like to take a few minutes with a real note of optimism that I think builds upon what Director Hayes has really said about the progress. You know, if we look back over the past year with COVID, it has been a long, long year, and I think everybody is still looking at some of the gray days we have here in the Northwest, thinking, will this ever end? But I think as we look back, I'm very optimistic, and for several reasons. First, we've now been through 3 waves of COVID and have, I think, really shown first and foremost that public health works. And, all of the things that people have been doing, the social distancing, the masking, washing of hands, but also, making real sacrifices, not seeing friends, family members, having family reunions, that has been a very difficult period, but it has worked. But on top of that, and I would always say that, an ounce of prevention is worth, not just a pound, but maybe a ton of cure. There's been real progress in terms of medical care. We now, first started out, there was very limited options in terms of treatment. We could support patients, with oxygen and ventilators and, the intensive care that we're able to do, but we didn't really have any known treatments that worked. And now we found that, measures including ones such as just how you position the patient by having them lie on their stomachs, they can sometimes breathe much better. New ways of delivering oxygen, use of corticosteroids have all shown improvement, as well as antiviral medications such as the monoclonal antibodies and remdesivir. But these have really shown progress that people are able to get better if they get hospitalized. But we still know that COVID, it's a serious disease. It is not easily cured. There's no magic bullet there's nothing as good as, say, penicillin, when penicillin was first discovered, or many of our antibiotics. So we have a way to go. But the December sort of advent of having the vaccines come and become available is really also an important game changer. The 2 vaccines that are available, both Pfizer and Moderna, are 95% effective. This is incredible. Flu vaccine is more often 60 to 70%. So the fact that these are 95% is extremely encouraging and are really helping. And so, I think as we look ahead, I would first say, congratulations to everybody for helping manage what we feared would be a severe surge in holiday cases and ones that could overwhelm our healthcare system. That did not happen. The healthcare systems have been terrific partners in standing up all the resources. But it's really the community effort, putting in these preventive measures that everybody worked hard to follow, that kept the surge from being too tall. The vaccines are able to work, and they will be a major changer in this game, but we'll also need to continue to work with the other preventive measures, such as masking and social distancing. But these risks are increasingly manageable, and so we've moved in just over a year now. We've moved from being in a place of having a pandemic, not knowing what was ahead, not knowing what would work, to now having tools to really manage this risk. And if we continue to work together the way everybody has, I think we can be quite optimistic that we will get through this and this will pass. So with that, I'll stop, and thank you very much.
Well, thank you, Dr. Barnhard, and thank you, Patty, for those overviews of what's going on now and the status of the vaccine. If you're just joining us, you're listening to a Tele-Town Hall sponsored by Aarp Washington with our guest, Patty Hayes, Director of Public Health of the Seattle-King County area, and Dr. Scott Barnhard, a physician from the University of Washington. If you'd like to ask a question of our guest, press *3 now on your telephone keypad, and you'll be connected to an AARP staff person who will note your name and question. And I think we should start taking questions because we have a ton of them. Let's start with Kevin from Bothell. Kevin? Are you there, Kevin? No, I don't hear Kevin's talking. Let's go on to, okay, how about Dawn? Are you there?
Yes, I am. Can you hear me?
Yes, we can. Go ahead.
Okay, good. I live, over an hour from my elderly parents, and they still live at home. One has severe dementia, 94 years old, 93, 94, and one is 88, and both still live at home. I'm very guarded about, going out or, so they have no computer. So I have gotten their recommendation. I've gotten their certification from the Phase Finder, and I just cannot find anything close for them as driving is limited for them. They can't stand in line. My question was, is there ever going to be mobile units that can give these people a vaccine so that they are, basically homebound almost, refuse to get health, care in their home? Do you foresee anything like that, or at least being, I'm on anything close that I could get, it's, no vaccines, no vaccines, no vaccines. So is there any type of a emergency wait list that we can be notified, or do you just have to sit on the computer all day long for months and to see if there's an appointment?
Yes, I know how frustrating that is. And So the answer to your question is a couple of different things. First of all, we are standing up mobile vaccination teams around the county. Right now, based upon the first level of work we're doing with long-term care facilities, those teams are actually going out to adult family homes and then senior housing, but we will look at homebound elderly in the next step with that. So again, we really acknowledge that for folks that have limited mobility and really are in areas that are not close, we want to do that. So that is part of the ongoing plan. And secondly, the federal government is starting to release doses, and I don't know if this would work for your parents, but they're starting to release doses directly to neighborhood pharmacies. And I expect that more and more local pharmacies over time are going to be getting it. This week, because of the snowstorm, I was just, as we were all talking here, notified that the shipment of the Moderna vaccine is stuck back east because of the snowstorm. So that's just another really unfortunate turn in the middle of trying to get vaccines out. But as Scott said, this is going to turn around. So those are two options for you to keep in mind, and to go ahead and make sure, as you've done, to have them have their names in Phase Finder, because that statewide call center, and again with what we're doing here in King County, will eventually follow up with folks as things become open more locally.
Okay, great. Thanks, Patty. Do you have anything to add to that, Dr. Barnhart?
No.
Okay. Patty, I had a follow-up question on that real quickly. With the pharmacies, I take it that once a local pharmacy does have some supply, they would still be operating under the same prioritization criteria you described earlier. Is that right? Healthcare workers.
That's correct. That's
okay.
correct. Their agreement with the federal government in order to get these direct shipments, because their shipments are not going through public health. They're coming directly from the national partnership. They have to follow the direction of the phases for who's available.
Okay, great. Well, let's go back to, thank you for that answer. Let's go back to the phone. Sally.
Yes.
Go ahead.
Yeah, this is Sally. Well, more or less the same question, which we all have. I'm 84 years old, and I unfortunately am not technically savvy, and so I have to rely on myself and friends on a telephone. And I've been calling for the last 3 or 4 weeks, and one day I did get put on a Safeway list because I was requesting the Bellevue area, and I obviously have not heard anything yet. But the trouble is, when my turn comes, I don't know how to access it on my computer, and I understand nobody does make a phone call to you. So I don't know how to follow through on these certain, questions.
Yeah, that can be really, really challenging. So if you have been directed to your local Safeway pharmacy, there's a couple of things you might want to try. If you know that you're on a list with your local Safeway and that's convenient for you, you might go ahead and just call over there to that pharmacy and let them know directly that you will need a call from them, because these pharmacies are going to have to start figuring out multiple ways. I mean, they work with their clients. They understand that not everybody can use computers. The other thing that we're working with the state on is to try and have a more robust way so people do, from their local providers, get a call back to try and address the situation that you're in. But if you've been directed to that local pharmacy, you might want to go ahead and just call and talk to the pharmacist over there about your situation.
Okay, great. Our next question is for Arlene. Arlene, go ahead.
Yes. I was wondering if there was some place that they were going to make to really update, like, the side effects from the vaccines. Like, you really have to look really hard to find out about lymph nodes, and it's really, there's difference of opinion whether it's 2 weeks or 4 weeks before you bother to check a doctor if that's one of your side effects or whatever. And so it's things like that, but where to find it? It's because it's a lot of work to try to find reliable references on the Internet.
Dr. Barnhart, do you have an answer for that, or do you want to take a shot at that?
Yeah, no, that's an excellent question. And first, I would just like to say that, the vaccines, we know from studies which have involved really tens of thousands of people, are very safe, but there are some side effects that people often get. In particular, people can, especially after the second shot, kind of have some mild flu-like symptoms, even some low-grade fever. But probably the best source for data on the side effects will be to go to the CDC website on COVID vaccines, where they give a complete listing. The other thing that I think is important, if you're having any questions, is to talk to your healthcare provider, because everybody's different. Your primary care provider will know you best, and I think can really help answer questions and interpret particular concerns you may have about the vaccine.
Okay. If you're just joining us, you're listening to a Tele-Town Hall about the coronavirus with our guest, Patty Hayes, Director of Public Health, the Seattle-King County area, and Dr. Scott Barnhard from the University of Washington. And we have over 3,000 people on this call. Obviously, this has struck a chord here, and lots of questions. Let's go to the phones. Gregory, Federal Way. Are you there?
Yeah, I'm here.
Go ahead.
Can you hear me?
Yep.
Okay. My question was, I understand the concern for all of us 65 and older needing it, but I also have been hearing a lot about the educators not feeling comfortable going back to school and so forth because they are considered frontline people, and I also see the young people suffering so much. Is there an update on when they're going to be able to get their vaccines and so forth? Get that whole area thing progressing?
Yeah. Thank you for that question. So in terms of educators, the Centers for Disease Control has put out some information just in the last 2 weeks to try and assist the education system, both in making sure that schools can reopen and be safe, and also to begin to address the questions around at what point would teachers be, as you said, in line to get the vaccine. So because of the limitations in the supply, I feel like a broken record. I apologize for that. But because of the limitations in the supply, the recommendations coming out from the federal government and the state really they are based upon the risk of individuals. And it's been pretty clearly indicated that in-school learning is not as high a risk as other frontline workers who are dealing with the public. And so teachers are obviously, like child care workers, they are essential workers. There's no doubt about that. And they will when we get into the next series of phases. But I would expect the next phase to open up would really be for folks who have chronic underlying conditions, who are around the age of 50 or above, and for those who are in super high-risk situations. So we'll see. What we do know is that schools can reopen, and I work almost on a weekly basis with the superintendents and the principals on their work, and there is a new focus to help get out testing to schools so that the teachers can be more confident because there's regular testing going on actually within the schools. So that's the next thing that the Centers for Disease Control is really starting to help our local schools with. So there's more to come on all this. I recognize that everybody in these frontline workers wishes we could open it up for them. And as soon as we get the vaccine supply, we will work through all of these phases as fast as possible.
Great. Thank you, Patty. Now it's quiz time for all of you on the phone. And like I said, we have over 3,200 people on the phone right now. We're going to give you an opportunity to use your phone to answer a question. And the question is this: how likely are you to get the COVID-19 vaccine? And I'm going to read these twice. So if your answer is we'll get it as soon as possible, press 1 on your keypad. If your answer is planning to wait a little longer to allow others to get it first, press 2. If your answer is want to learn more about the vaccine before getting it, press 3. And I do not plan to get the vaccine at all, press 4. Let me go over those again. Press 1 if your answer is we'll get it as soon as possible. Press 2 if you're planning to wait a little longer to allow others to get it first. Press 3 if you want to learn more about the vaccine before getting it. And press 4 if you plan to just never get the vaccine. And we will tabulate those and get back to you with the answers and the totals in a little bit. Again, you're listening to a live Tele-Town Hall sponsored by AARP with Patty Hayes, Director of Public Health at Seattle-King County, and Dr. Scott Barnhard of the University of Washington. And let's go back to the phones. Anthony from Seattle.
Yes.
Go ahead.
My question is the inequity of people of color getting vaccines. I know people are trying to get the vaccine, but they've got to drive so far, and then no appointments are available. So my question is, why isn't there anything within the black and brown community where we could go and get a shot? A lot of people also are afraid of taking the shot because of they fear lack of education. And I've even heard people say that the shot would change their DNA, so they're not taking the shot. So,
well, thank you for this question. You've raised really, really important parts, and I'll let Scott answer some of the questions about the vaccine. Let me start with the large concern that Public Health Seattle-King County has had, and that is how do we push to make sure that vaccine is available in the Black community, in the Latina community, because we do see higher rates in our indigenous communities, because we do see higher rates of COVID infection and higher hospitalization rates and concerns. So what we actually did is look at the community to where folks reside, and we are pushing for access sites, mobile teams, and as I mentioned, our 2 sites we purposely opened in the South End to try and make the priority be for our BIPOC community in the South End. And I'm delighted to say in the first week of operation in the South End of King County, over 50% of the folks that accessed vaccine down there were from our communities of color. So that's a very important, and our county executive announced the equity initiative we've got. So we're watching the data very closely on access points so that we're actually pushing doses out into communities. And the federal government also just prioritized vaccines to go to our community health centers who are located throughout the county and are another great access point. So you have local pharmacies that can be in the communities with our communities of color, our access points, we're setting up mobile teams, and then the community health centers. So we're hoping by taking multiple strategies that the vaccine becomes available, and we're watching the uptake. So, Scott, do you want to talk a little bit about the misinformation that's out there on the vaccine?
Yes. Thank you, Patty. And, this is a very important question, and, I would welcome, and I know the Health Department welcomes any input on how to, where there are questions and how we can best answer them. But in terms of the question of the vaccines, they are extremely safe. As I mentioned before, they've been tested in literally tens of thousands of people. The vaccines work. The 2 vaccines that are approved, which are from Pfizer and Moderna, work not by changing a person's DNA at all, but they rather use something called mRNA, which is something quite close to DNA, but this small little packet of information is used to basically tell the cells in your body to make a protein that is associated with the coronavirus or COVID virus. And so once your body makes this protein, your body will recognize it as something that's foreign and will build the immunity that you need to have to protect you from it. So it is, I think, it's a confusing thing because the 2 vaccines do use something called mRNA, which is similar but quite different from DNA. And it is that mRNA that tells your body to make the first step, which is to make a certain protein, which we call an antigen, and then that is what your body will recognize as foreign and build and strengthen your immune system. So, and again, as I've said, this is something that has been shown to be quite safe.
Great. Thank you for that answer. Results of our poll, it appears that there's a lot of people on this call who plan to get the vaccine. With response to the answer, we'll get it as soon as possible, 77%, or more than 3 in 4 people on the call, plan to get the vaccine as soon as possible. Planning to wait a little longer, 10%. want to learn more about the vaccine before getting it, 11%, and only 2% say they do not plan to get the vaccine. I really do appreciate, though, Dr. Barnhart and Patty addressing this question of vaccine hesitancy, because we do know that it's out there. Let's go back to the phones now. And Karen.
Hi there. I am a physician assistant, and, we're trained with the medical school. I have some free time and wondered where the best place to volunteer might be, where I could help out the most. I also have a second question. I have a 21-year-old senior at UW who's the head manager of the men's Huskies basketball team. She travels regionally with the team, and her being on the front lines, going to LA, Utah, Colorado, all over the place, I wondered if she would be a frontline person that could get vaccinated.
Well, thank you for that. Let me start with the last question there. I've been working with the UW Husky Athletics, and they have done a great job putting in a lot of prevention measures. And I know that the folks in these team sports are working really hard to keep themselves safe and to really mask and as they travel, make sure that they are protecting themselves to reduce their risk. Again, because of the limited number of vaccines and the impact of COVID, which is so much harder on older people, these students wouldn't be moving up in line beyond later phases to get their vaccines. But I actually have a high level of confidence in the UW and how they've been managing things. And when they do have an outbreak on the team, they've been isolating folks very well and taking care of it. So happy that they're doing that. As far as volunteering, thank you so much. So appreciate it. You can go onto the King County website and look at joining our Public Health Reserve Corps. But in addition, I know that many of our other partners, like Swedish, has an active volunteer group too. So I think there's many of the sites and partners that you see are sponsoring them are looking for people interested in volunteering. So thank you for that.
Yeah, boy, that's quite an offer at a time when we need more help like that. Another question from Tom at Sammamish. Tom?
Hi, can you hear me?
Yep.
Yeah, mine's twofold. One, I mentioned to the question asker, but let me see if I can articulate it more clearly, in that I'm an individual over the age of 55, currently have active cancer, type 2 diabetes, reduced immune system. In other words, my white blood cell is incredibly low. I have 4 individuals who work in my house in grocery stores and other locations. A couple weeks ago, we had a scare that one of them actually brought COVID home. So that was a little bit of a scare, but it turned out he just had the flu. So my frustration is watching other states like Illinois, Florida, friends and family showing up on Facebook saying, hey, I'm over the age of 50. I just got my second shot. That's a good time to be in the pandemic. And I'm sitting here in my situation, and I can't even qualify to get on the schedule and have the schedule problems people are having trying to get in to get a shot because I don't qualify currently, and I don't understand why someone like myself doesn't qualify. My second question, though, is if I have a reduced immune system and I get this shot, it's supposed to make the protein so my body can build up the immunity with it. Is it going to kill me because my immune system can't handle or generate the proteins? What's the condition there? So those are my 2 questions.
Yeah, great questions. I'll let Scott handle the second one. And I share your frustration with the state of the vaccine allocation to Washington State. It has been long a call that myself and other local health directors have made that in Washington State, we really are not getting the level of allocation federally that matches in other parts of the country, and that's when I guarantee you we will continue to push. We are definitely looking at how quickly we can move through these phases to get, and you raised the challenge that the State Department of Health has in setting the phases, where trying to look at these unique circumstances that you've raised, where you're in a household with folks who are working on the front line, can get exposed, and you having a high risk set of circumstances. And the phases just acknowledge that they don't address all these unique circumstances. I have been, and I know that the Seattle Cancer Care Alliance is in active conversations with the governor about the next set of phase openings for where folks who are under active cancer treatment can get placed in line. So, Scott, you want to answer the question around the vulnerability and the vaccine?
Sure. So, yeah, this is an important question, and I think as we all recognize, as we get older, our immune systems get weaker, and then there are certain things, and it's very dependent on the kind of cancer, but cancer, the development of kidney disease, just bad nutrition, diabetes, lots of things can further weaken our immune system. As I mentioned, the way the vaccine works is it basically instructs your body to make just the foreign protein of the virus, not the entire virus, and then your immune system will react against it. We all, really everybody on this call has some level of immune system, and that immune system is for the most part able to protect you. And so I would be optimistic that taking the vaccine will actually allow your body to have a good immune response. Will it be as good an immune response as a 20-year-old? Probably not, but you will build immunity to it, and that immunity will either give you complete or partial protection from the disease, but importantly will really reduce your risk of very severe disease or hospitalization from COVID. So, is it can it provide perfect protection in somebody with a compromised immune system? No, but what we've seen, at least in the large-scale studies, is that people did do very well, including people in older age groups who, by definition, will have reduced immune systems.
Thank you very much for that, Dr. Barnhard and Patty. And Patty, maybe you can take another shot at this. We had a Facebook question from Jerry from Auburn. Please explain more about what multi-generational household is as it relates to the eligibility. I have this question myself. I take it that being a 63-year-old with a 20-year-old daughter at home is not the definition of a multi-generational household that you're describing earlier.
Right. And I shared some in the beginning, the confusion. So there's a lot of questions around this eligibility. So here's what it says. It's people who are 50 or older who live with two or more generations in a household, and they have to meet one of these two criteria. Either they can't live independently, in other words, they're receiving support from a relative or caregiver, or they live with and they're caring for a young child like a grandchild. So it has to have both the age and that there's these multiple generations, and they either can't live independently or they're like caring for a grandchild. So someone who is able to live independently and just happens to live with their 30-year-old child, as you said, is not eligible right now.
Okay, good. Thanks for that clarification. Back to the phones. We're coming towards the end, but there's so many people in the queue. I want to get as many questions as we can. Jennifer.
Morning. Good morning. I have questions. Pfizer's one shot. Moderna requires 2 shots. I was lucky. I have snagged an appointment for mid-March. And my question concerns the only vaccine I can get is the Moderna, and I understand that the Pfizer, their efficacy is much better, much higher. And since I am high risk, it seems like Pfizer would be the one that would be allocated to our category. Can you explain the efficacy differences, please?
Yeah,
I'll let Scott answer this one. Yeah.
Sorry.
Right. Well, a couple of things. I would first say that both Pfizer and Moderna require 2 shots. The Pfizer is 1 shot and then followed in 3 weeks by a second shot. Moderna is 1 shot followed in 4 weeks with a second shot. And both of them in their emergency use authorization application had an efficacy of about 95%. So I think that their efficacy is quite equivalent. You really don't have a choice. I don't know of any sites that are giving you a choice of Pfizer or Moderna. I think most people, because the efficacy is the same, are just taking whatever's available. And when I'm asked by individuals, patients, and others about this, I always just say, if you can get an appointment, please go ahead and take it because that's in your very best interest.
Okay, thank you for that answer. Ken from Federal Way, you have a question.
Yes, my question is, first of all, I want to thank everybody for doing this. This is incredible, and I really appreciate it. I'm sure all the callers do as well. So my question is, I'm fortunate enough to be on the schedule for a shot, my first phase shot, at one of the King County mass vaccination sites, Auburn. The question is specifically for the second shot, do I need to go find, through Phase Finder and that type of thing, my second shot and schedule myself, or will that be scheduled at the time that I receive the first shot at that location?
That's a really important question. Thank you. So when you go to one of these sites, you will be given the ability to set up that second vaccination site. It is expected that we would bring you back to that site for your second vaccination. So we want to make sure that you have that all on your calendar already. So that should happen when you go down for your shot to be able to sign up for the next one.
Okay. We have time for a couple more questions, then we're going to have to wrap up. Let's go to Mildred. Hey there.
Thank you for answering my question ahead of time here. I was wondering, I was a travel nurse and I'm 90 years old, so I had a lot of experience with infectious diseases as a home health nurse. And one of the questions I have is there is a resource. I know people at home are having care from healthcare professionals already because of various diagnoses. Would it not be possible to endorse more availability if we would increase the ability of the staff who work in these home health agencies, if they could give the vaccination? And maybe is this something that we could plan? Because I know patients even get IVs at home. So I was wondering if we could increase the amount of the distribution by using that resource.
So
would that be a
definitely
possibility?
Yeah, thank you. Definitely as the number of doses increase, we will be able to increase the number of providers. There's actually over 100 providers around King County that have been approved by the Department of Health because This vaccine is new, and because there are storage and handling things that are very, very strict with these vaccines, you have to be an approved provider. So there are over 100 approved providers. Not anywhere near that many providers are actually able to get the vaccines right now. But what I predict is as more vaccines flow, and there's a possibility of even a third vaccine being approved by the federal government, that we will see more and more of our local providers, whether or not that would be our mobile teams, whether or not that's your local fire department, whether or not it's a pop-up at your senior center, whether or not it is more of the grocery stores with their vaccination clinics, Costco opening it up. We will see more and more of these that are closer to your home so that we can get more access points. So it's just a matter of two things. Number one, the number of vaccine doses that are available and allocated into King County. And then number two, the provider needs to get approval through the State Department of Health and the training to handle these new vaccines.
Great. Well, thank you for that answer. And we've come to the end of our time here. I want to thank all the people who stayed on the line. We had over 3,300 people on this call today, which really shows you just the level of interest in this. And I'm so grateful to our two experts, Patty Hayes, Director of Public Health, Seattle-King County, and Dr. Scott Barnhard for answering all of these questions. I want to give each of them just a final chance to say some closing remarks, starting with you, Patty. And I don't know if you want to repeat some of those numbers you gave at the beginning of the call or whatever, but do you have a couple closing words?
Yes, thank you so much, Doug. First off, thank you for all of you to being on the call today to get this information. It's really my pleasure to be here. So appreciate your ongoing efforts to stay healthy. I do want to repeat some of these things. So first, for the Phase Finder, that website again is www.findyourphase.wa.org. And then the phone number I want to give you again is the state's COVID-19 Assistant Hotline, and that is 1-800-856-5816. So I wish you all just the best as we get through this together, and really appreciate we all are packing patience, but we're all working together to get through this pandemic. Thank you.
Thank you, Patty. Dr. Barnhart, a couple closing thoughts?
Yes, well, I just also want to thank everybody for participating and for the excellent questions. I guess the one thing I would leave everybody with is that I know that at this point, over 40% of individuals who are 65 and older have had at least a first dose of the Moderna or Pfizer. And so we are making really good progress. And for those of you who have friends or family members who are hesitant about getting the vaccine, I can just want to assure everybody that the risks of getting COVID are so much worse than the really minor side effects that have come and been shown to occur with the vaccine, that it is really in everybody's interest to encourage your friends, family members, as soon as they are eligible and can get that appointment, and they will come, those appointments are going to open up soon, to please get it. So thank you very much.
Great. Well, once again, AARP wants to thank Patty Hayes and Dr. Scott Barnhart for joining us today. In the face of this crisis, AARP is committed to providing information and resources to help older adults and those caring for them protect themselves from the virus, prevent its spread to others while taking care of themselves. Thank you for participating. We apologize if we're not able to answer your question today. You can also obtain valuable information like those that Patty Hayes gave you, but also AARP publications by going to our website, www.aarp.org/WA vaccine. And you can also call 1-866-227-7457. Thank you and have a great day.